Well, more than a year later, and COVID is still a major part of our lives on a daily basis. To that end, people are continuing to put more focus and give more attention to getting the help they need in regards to their mental health. In this segment, sponsored by Emerald Psychiatry and TMS Center, they're sharing more on how that works with the major shift in telehealth.
And Dr. Scott Yoho with me now. He's the owner and medical director of Emerald Psychiatry and TMS Center. So good to have you with us, doctor.
Thanks, Robyn. Glad to be here.
I want to first talk about the transition to virtual visits. How has that been for you as a physician, for your patients, when it comes to seeing them just like we're talking right now?
18 months into this whole COVID issue, we pretty much had to shift 100% from inpatient visits to televisits, which is actually a passion of mine. I did my grand rounds presentation at Ohio State during residency on telehealth, because the psychiatry field is very well positioned to, help get expanded offerings and care to people that might not actually be able to get it on their own. And so it's been really great. It really is kind of like more like a house call, like the old days, where we can come to you, and we're doing a lot of visits in cars and at work and various places, which is new. But in general, the patients love it. Our no-show rates as far as like patients who aren't able to make their appointments is way down. I think that kind of speaks to the convenience of telehealth.
And you guys do have a lot of platforms that you utilize. I know there's something called Doxy you have. You also have a group therapy outpatient program that you're able to do virtually. So there are kind of the services that you offer can all really be done mostly via virtual visits.
Yeah, in fact, the only patients we have coming into the office are TMS patients. TMS is transcranial magnetic stimulation. It's a treatment we do for depression that hasn't responded to first-line treatments like psychotherapy and medication management. Very well tolerated, very safe, really becoming more standard of care. But those are really the only patients we have coming into the office. Everybody in the office, as far as the employees, have all, are required to take the vaccine. We've done a lot of things to make sure it's, a safe environment, and really haven't had any issues with that. But you're right. In the last year, we've added a mental health IOP, which is intensive outpatient. So patients who are having functional impairment and aren't able to work or function as well as they'd like can, do tele, and it's usually about 3 hours a day, 3 times a week, Monday, Wednesday, and Friday. And, dealing with things like severe anxiety or depression or various other things that could be, treated with more therapy at the beginning.
And I imagine you have seen a demand increase over the last year and a half. Do you think people are becoming more open to doing things, and maybe even doing them virtually makes it a little easier to kind of have that first visit and say, hey, maybe I do need some help dealing with these issues? I
definitely think so. I mean, mental health has been kind of one of the forefronts of the COVID era. A lot of celebrities and, more people talking about it, which is good, because, really mental health issues pervade across all, economic, socioeconomic categories. So whereas it may have been more taboo before, like now it's much more accepted and, really encouraged for people to reach out and get help. And, with the tele, that really lends itself to that model where we can kind of come to you and make it more convenient, for sure.
If someone out there, though, is watching, they want to learn more, they want to set up an appointment, what's the best way to go about doing that?
Yeah, so actually we have pretty much immediate availability. Like you could call now and get an appointment within the next 2 weeks. We've added providers to kind of help fit that need. Our website is emeraldpsychiatry.com. Our phone number is 614-580-6917. So those are usually the 2 places I recommend, because we do have a link option on our website to schedule a new patient appointment.
Okay, so there you go. It's Emerald Psychiatry and TMS Center, as you mentioned, offering that service as well. So Dr. Yoho, thanks for being with us.
Yeah, thank you. Appreciate it.